and should be good to go.
Right. So I go again?
Yeah, you go again.
Sorry.
It's all good.
It's okay. It's okay. There are millions of Americans suffering heavily from unforeseen damages caused by the pandemic. There is no better time to pass healthcare reforms when America needs it most. Due to the ongoing pandemic, the United States has seen over 500,000 Americans pass. Passing this healthcare reform will save many American lives. In addition, according to MedCity News and a poll by Gallup, 1 in 5 Americans are struggling to pay for healthcare, or roughly 50 million Americans. If universal healthcare was implemented at a time before the pandemic, many Americans would still be alive. Due to America being one of the last modern societies lacking universal healthcare, many Americans have been questioning why universal healthcare hasn't already been implemented. Universal healthcare would provide cheap medical assistance to those who need it. People are constantly dying due to not having adequate healthcare, and universal healthcare will ensure that everyone living in the United States has healthcare. Universal healthcare will save lives. Our plan is for the United States government to provide healthcare to anyone living in the United States. Private healthcare companies will still be competing to create new healthcare products, as well as offering services to those willing to pay. The government will control prices by negotiation and regulation amongst the healthcare giants. If universal healthcare is implemented, the large number of Americans that mainly use the emergency room as their primary care provider will no longer have to, as preventive care will be covered by the government, as well as a decrease in the cost of healthcare due to a drop in emergency room visits. According to the CDC, roughly half of the 18 to 64-year-olds who visit the emergency room visit because they simply have no place else to go. Because universal healthcare will provide everyone with healthcare, it will prevent future medical problems for those who may not have been able to receive early treatment. By implementing universal healthcare, the general public's health will surely see an increase.
Okay, and I think it's my turn. Yeah, okay. Just a couple questions. So you had mentioned that the government would be responsible for regulating the prices of healthcare and its services. So do you want this to kind of like function as a single payer system where the government would be solely responsible for everything healthcare related for its citizens?
Not quite, as the government will provide healthcare to everyone. Private companies will still be able to have customers of their own. People will still be able to pay for the treatments provided by the health giants that already exist.
Okay. And for my second question, would it not just be more efficient to provide healthcare for the people who aren't normally able to provide it instead of providing it for everyone when a majority of people are already able to afford it?
From my perspective, I see providing everyone with healthcare as a way to alleviate economic stress on those who are already able to afford it. So those that can't afford it now will still, even though they can't afford it, they'll still be offered healthcare, and it may help with their economic situation, especially during now in the pandemic.
Okay.
Universal healthcare is a plan many want to see passed without understanding the consequences. For one, passing universal healthcare will decrease the overall quality and variety of care. In research done in other countries with healthcare, patients often see long wait times or even have to wait months to be seen at all. Furthermore, since governments are focused on providing essential and life saving healthcare, they may neglect to cover rare diseases or elective procedures. The quality and variety of treatments will decline, meaning a large percentage of the US's population will suffer even more without the effective care they are receiving now. Secondly, with universal health care, healthy people will be forced to pay for others' medical care. Statistics show that chronic diseases make up 90% of healthcare costs, which mean the sickest 5% of the population create 50% of total healthcare costs, while the healthiest 50% only create 3% of costs. This means many healthy people will be putting their money towards a plan they do not need. Along with this, the passing of universal healthcare can come the rationing of medical services. In order to compensate for the massive cost that is to come with universal healthcare, not only will high taxes be implemented, but some medical practices and services may even be restricted, as they may be labeled cost inefficient. According to State of Reform, such was the case with the specialized congestive heart failure program created at Duke Hospital Medical Center. The program improved patients' outcomes. Medicare pays hospitals for providing health services, not for improving people's health status. Denying any possible form of healthcare, regardless of how cost and effective they are, only hinders patients that need all possible solutions to help their illness or injury. Lastly, with the passing of universal healthcare, everyone within the country will have access to healthcare. However, this would end up leading to congestion among hospitals. Using Canada as an example, since they provide universal healthcare, the average waiting time for people from referral from general practitioners to consultation with a specialist takes an average of about 19.8 weeks, whereas in the US, it could take around 20 days to do the same checkup. So while it is true that healthcare becomes available for everyone, it is also inadvertently becomes less available because wait times will greatly increase due to everyone scheduling an appointment. Yes, healthcare is an issue in the US that needs to be addressed. However, passing universal healthcare is not the solution.
Okay, and then I think I have some questions to ask. So firstly, granted it may not be the most effective, is some healthcare better than none for those that wouldn't have been able to afford the most effective treatment?
In some ways, yes. Obviously, universal healthcare does cover everyone, and that is a great thing. However, when you are trying to enact a plan such as universal healthcare, I feel like you need to look at the bigger picture. And as we can see from other countries that do have universal healthcare, we can see that there are much longer waiting times and there is a decline of the quality of care that we receive. And so I believe the negatives outweigh the positives.
Okay. And then for my final question, if given the opportunity and power, how would you adjust other countries' universal healthcare systems?
I would probably keep it the way the United States is in terms of like having private insurance, but I would definitely make it way more affordable and accessible. And it would probably have, it would offer like lower prices to those with a lower household income if there are disabilities within the family, and also it would depend on how many children are in the family.
Okay. Thank you.
Thank you.
The demand for universal healthcare has increased so much in the past couple of years. People are getting more sick, especially with COVID-19. People are needing health support because of the pandemic. I believe healthcare would always be high quality because doctors would perform the same amount of work they would under any condition. I believe the performance and quality of the care would be just as good. Also, as you mentioned earlier, people would have to pay for healthcare they most likely won't need if they are healthy. However, I think healthcare should be provided for everyone because illnesses come out of nowhere and people can get sick and they always need the support. As well as if someone gets into a car accident, by having healthcare, they would be getting the full support from their care and they don't have to pay a significant like amount of money if they get into a car crash. Now, universal healthcare would not just come for free. People would still need to pay some money, such as you mentioned, through taxes. However, they will probably need it because it's a necessity. Just like how people pay for public school parks and libraries and like more things from their tax money, they would be paying for their healthcare the same way. Also, I believe private insurances would still exist and be popular for people who would like to perform other surgeries that would be labeled as cost efficient by the government's healthcare because they can be surgeries that the person would want, but they wouldn't need to support their health. And in that case, people would still have the option to join private health insurance companies and get the support they need. And as my partner mentioned earlier, by providing healthcare for everyone, including kids who wouldn't need it as much because they probably are not as much as sick or they don't have illnesses as much as older people, this can prevent future illnesses and keep kids at a healthy lifestyle and be healthy when they grow up. This can prevent future illnesses and future costs for the healthcare insurance. As well as by providing healthcare insurance, the government would have the power over drugs and medicines costs. After doing the research, medicine is very expensive in the US. Compared to other countries who do provide healthcare, such as Canada, it can be unaffordable. By giving the government the power, they can by giving that power, they can lower the cost and they can spend the amount of money they would want to spend on it. Healthcare is important because people need it to survive, and it is unfair for someone to be sick and die from an illness that could have been easily treated at a hospital. It's just that they didn't have the money to pay for it. This is beneficial for everyone because healthcare is needed, especially in times where there are a lot of emergencies and a pandemic going on.
So I just have a couple of questions. How do you intend universal healthcare to be covered?
I think money wise, like other countries have been doing it, like maybe taxes would definitely be raised. But I also think like for California, for example, the taxes is 9 point something percent. And if they would hire it to 12%, it would still make a little difference when like you're paying your taxes. But I think it's better than like going to health insurance and paying like 120 or $100 a month for a private insurance, or like not having insurance, and if you do get sick you're paying $3,000 at like one go, if that makes sense.
And do you think passing universal healthcare will create an overload in hospitals and doctors' offices? Why or why not?
I personally don't think it would. Many people are worried that by providing universal healthcare, doctors wouldn't get paid as good, or they wouldn't like they people would let go of them. But I think by providing universal healthcare, like the demand for doctor would definitely be higher, and like people would need more hospitals. So if we do provide healthcare, like a lot of that money can go into building new hospitals and like hiring more doctors to perform, so like there's more space for the people to go, so they don't have to have like long like waits every day.
Thank you.
And I think it's my turn to go. All right. So now I will say that the affirmative side has brought up some very good points as to how universal healthcare can work within our society. However, each point isn't without its downsides or backfires. To start off, the affirmative side had mentioned that with the passing of universal healthcare, emergency room visits would decrease as a result of every American citizen having access to preventive care, overall resulting in a healthier workforce. Now, while this may be true initially, I also think that it is too idealistic of an outcome to be able to maintain providing preventive care for every American citizen. So while it may be true that emergency rooms will see a decrease in visits, it is also true that there will be a congestion in people seeking preventive care. As mentioned by Jeanette previously, an article had analyzed the average wait times for people receiving preventive care within Canada. The average wait time of a citizen between receiving a referral from a general practitioner to consultation with a specialist takes an average of about 19.8 weeks. In comparison, the same process could be accomplished within the US in about 20 days. This difference in wait time is too big, and it could inadvertently result in an increase in emergency room visits, but not because people aren't able to afford preventive care, but because there are too many others seeking it as well. In addition, another advantage that the affirmative side has brought up is that universal healthcare can lower the cost of healthcare and medication, as the government will be able to regulate the prices. Now, the government can't just automatically lower the prices for everyone's benefit. It doesn't work like that. The most likely case is that medical services will have to be rationed in order to keep funding universal healthcare. This was also mentioned by Jeanette previously and is one of the main reasons as to why we think that universal healthcare is not the best decision for America. To deny a potentially life-saving service just because it is not or it's labeled as cost inefficient is not a good enough reason to withhold the service, nor is it fair to the patients that require such services. At that point, the very basis of universal healthcare becomes just providing healthcare services rather than improving people's general health. Lastly, I also want to point out that in most cases, the healthiest people will most likely end up paying for the medical services of the sick. This ties in with my previous claim, as this will most likely be another consequence of providing everyone cheap, affordable healthcare, alongside with the rationing of cost of inefficient services. Not only do I believe that it's not fair for citizens who aren't constantly sick to have to spend their money on people who are constantly sick, I also believe that this method is highly inefficient. One of the main motives for passing universal healthcare is to provide healthcare for the people who normally aren't able to afford it. So, providing healthcare to a majority of people who are already able to afford it, not to mention making them responsible for paying for said services for everyone else, is not the best solution. Instead of passing universal healthcare, the government should mainly focus on being able to provide healthcare for the minority that can't afford it, instead of having everyone else provide the funding. This way, everyone will be able to receive healthcare without the drawbacks that universal healthcare can bring. So, while I do sympathize with wanting to make sure that everyone has access to healthcare, I don't believe that universal healthcare is the best method of accomplishing such a task.
I have a few questions. So I noticed that you mentioned that that like by providing universal healthcare, doctors wouldn't perform the best and people wouldn't get high quality treatments. How do you think doctors' treatment would be worse if universal healthcare would pass, and why do you think it would be worse?
Well, in that kind of situation, it's kind of like a supply and demand case. You see, by providing everyone healthcare, the demand would rise because everyone is allowed access to it. But the supply still stays the same because generally doctors aren't going to increase in numbers. They won't have an increase in equipment, nor will they gain better quality equipment. They don't benefit in this case. And with the increase in patients, they would have to ration out their services to meet the demands of everyone. This would result in either lower quality treatments or by not being able to provide everyone treatments because, well, there just isn't enough to go around for everyone.
Okay, and then what do you think, like as an example, like you personally, what do you think would happen for someone who is completely healthy, but they don't have health insurance, and then they get into a car accident? How would they pay for it, or how would they get care?
Well, in that kind of situation, that's why I advocate for a system that has the government pay for the healthcare of citizens that aren't normally able to afford it. That way, even though they aren't responsible for the majority of the costs that come with universal healthcare, they would still be able to have access to it because the government provides it for those that aren't able to normally have it.
My opponents believe passing universal health care will reduce the number of individuals who go to their emergency room, create a healthier society, and reduce the cost of healthcare and medications. On the contrary, universal health care would do the opposite. As stated, individuals living in countries that provide healthcare see wait times up to 5 times longer than the US. Because everything will be covered, actually more people would be in the emergency room as they now will not have the fear of dealing with the large hospital bill. Furthermore, we may actually see a more sickly society due to the fact that certain medical practices and services may be restricted as they may be labeled as cost inefficient, overall reducing the quality of care we receive today. Lastly, the cost of medications will not decrease. If anything, because the US will no longer be profiting off the many people paying for healthcare or hospital bills, Big Pharma will probably increase medication prices. Due to the numerous disadvantages, universal healthcare is not the solution the United States needs. Instead, it necessitates a solution that does not further harm those in need of care.
Although universal healthcare would cost the United States trillions of dollars, the general public's safety should be the largest concern. Private healthcare would still be able to compete with each other and cater towards the wealthier portion of the population, ensuring the safety of all Americans regardless of socio or economic status. is what the country should strive for.